what are the real risks of testosterone replacement therapy? I'm going to share with you what the most important is to know about testosterone replacement therapy, and also discuss why it's so feared by doctors to start their patients on testosterone replacement therapy. Here is the bottom line. So this was the first study right here that showed that there was a potential risk for testosterone replacement therapy to cause more cardiovascular disease. However, this study was only done in about 200 patients, and their average age was 75 years old, and they had a lot of comorbidities. After now that we have the time and the luxury of being able to look back, this study had specific gaps, which was the specific patient population that was used, and also the age of the patients, and also the fact that the study was ended earlier. Now, this study right here was the second study that came in 2013, and it kind of solidified that idea into practitioners that testosterone replacement therapy equals heart attacks, and that's why most doctors are terrified of prescribing testosterone replacement therapy. Now, this study right here actually was a retro study, and also it was focused on a very specific patient population that already had many comorbidities. The problem with retrospect studies, or studies where you look back at data, is that you might have a lot of confound biases or selective biases, meaning that the researchers are maybe trying to look for unconscious or conscious, picking out the different charts that they look at. Another issue with this study was that it was not recorded what type of frequency, volume, intensity was used for these testosterone replacement therapies, which could be a huge differentiator on how testosterone replacement optimization therapy is done. Now, this study right here started to change everything about what we thought about testosterone replacement therapy, because here they took approximately 6,355 patients' records from Medicare, and they looked back and saw if somebody had received an injection, at least one injection of testosterone, would their risk for a heart attack increase. And after looking at the records of 6,000 plus patients, their conclusion was that older men who were treated with intramuscular testosterone levels did not have an increased risk of cardio, like myocardial infarction or heart attacks. So this was the huge transition from thinking that testosterone replacement therapy was bad for us. Now understand that actually it does not increase the risk of heart attacks in men. Since then, there has been many studies that show that testosterone replacement therapy does not increase the risk of cardiovascular events. Here's one of them. Here, they tried to understand all of the data that had been published up until 2022. And here is what they came up with. It showed that after looking at 9,871 citations, there was about 225 studies, right? Out of those, they specified studies that met their criteria to become better statistically significant. And out of that, all of those combined studies studied about 5,600 people. And here is what they concluded after looking at all of those different studies on an average age of 65 years old. They found no evidence that testosterone replacement therapy increased short-term to medium-term cardio disease. And so as we speak right now, studies are actually showing the opposite of what was thought previously in the 2010, 2012. Now we know that this does not seem to be increased by testosterone replacement therapy. In fact, testosterone replacement therapy actually improved the cardio profile of people, increasing muscle mass, decreasing fat, which in turn increases and improves a lot of other health markers.